The commonest condition of mental retardation in humans is due to a condition which is known as Down syndrome. It's also called trisomy 21. Today, I'll talk about the diagnosis of Down syndrome or trisomy 21. Please watch the video until the end and subscribe my channel to know more of these medical awareness topics. Now, as I said, this condition is trisomy 21. Normally, we humans have pair of each chromosome. In this condition, there are three instead of two in number 21 chromosomes. So 321 chromosomes lead to trisomy 21, Down syndrome, the commonest cause of mental retardation. There are other trisomies like trisomy 15, trisomy 18, Patter's, and Edwards syndrome. But in these trisomy 15 and trisomy 18, the babies don't have live births because they are congenital multiple abnormalities which lead to commonly a death in the uterus. But trisomy 21 are often born alive and becomes a burden for the parents to look after throughout their lives. Actually, 70% of trisomy 21 or Down syndromes are miscarried, but 30% are born alive and then they have to be looked after until their death. Now, this condition can be screened. What is the chance of the mother to have a Down's baby? Actually, as the maternal age progresses, as the equality deteriorates with the age, the chance of having these chromosomal anomalies, especially Down syndrome, increases. The chance of having a Down's baby after the maternal age is 35 is significantly high. The screening procedure can be done very early, between 11 to 14 weeks by a double marker, where we measure two hormones. A blood test is done to the mother and two hormones are measured along with an ultrasound which checks the nuchal thickness, the thickness of the neck of the baby. These findings are sent into a software. Software gives a result. The cutoff is 1 in 250. If the result is more than 1 in 250, then the mother has less risk of having a Down's baby. The screen becomes a negative. There's also a quadruple test which can be done around 16 weeks, which is measuring 4 hormones and sending the result into a software. Now, above 1 in 250, as I said, the chance is low, the screen is negative. But below 1 in 250, the screen is positive. If the screen is positive, how do you know whether the mother actually carrying a Down's baby? For example, if the screening test says a 1 in 100 chance of a Down's baby, that means 99 babies would be normal, one pregnancy would be affected with a Down's baby. How would you know that this pregnancy has actually a Down's baby? Then a confirmation test has to be done. There are two types of confirmatory tests. Number one is amniocentesis, taking the fluid in which the baby is floating. This is a highly skillful, risky procedure. Only few people are licensed to do that. It gives 100% confirmation because this amniotic fluid contains cells of the baby and the chromosome can be analyzed. Other tests, much less risky, a new development, a new technological development is known as NIPT, in which the maternal blood is taken and in the mother's blood, actually, baby's genetic material is floating. And if this amount of this genetic material in the sample is above 4%, it gives about a 96 to 100% confirmation whether the mother is carrying a Down's baby. Now, once the confirmation is done, it's either negative or positive. If the mother is carrying a normal baby, as the confirmation says, the pregnancy would be continued. If she unfortunately has a Down's baby, high risk of Down's baby, and it's confirmed that this pregnancy is actually carrying a Down's baby, then the parents will have the option of termination up to at least 20 weeks, and now with the new legal leverage up to even 24 weeks.